Hi, everyone. I'm Dr. Samantha, the maternity mentor, and welcome back to another one of our live Q&A sessions that we have here every Monday at 9 p.m. Eastern Standard Time. This is a chance for you guys to ask any questions that you have live here in the chat, and we also take the time to go ahead and answer any questions you might have placed on our videos. So please sit back. If you have any questions, please feel free to put them in the chat. And remember, share the channel with your friends and family. Follow us on Facebook, on Instagram, on Twitter for additional content. And like and subscribe and hit the notification button so you can get notified when our next video comes out. So before we get started with some of the viewer questions from the videos, I noticed that we already have a question in the chat, which is great. So hello, Letty. It says, hi, ma'am. What are your go-tos for urinary tract infections? If your patient had low levels of bacteria in their urine, would you treat this with an antibiotic, or would you not consider this a UTI and wait it out and retest? So this is a great question, and it's a very important question. So let's talk about urinary tract infections. Urinary tract infections are infections that are found in the urine. They usually start in the bladder. The bladder is where your urine collects before you go to the bathroom. So oftentimes what happens is you don't empty your bladder completely, and that little bit of urine that's left over, which does have some bacteria in it naturally, will go ahead and it starts to grow and multiply, leading to a urinary tract infection. Now, urinary tract infections, if left untreated, can actually lead to a more serious infection called pyelonephritis. Pyelonephritis is a fancy name for a kidney infection. So you have your bladder and you have the urethra, which goes down and outside. That's the little tube that you pee. Going up is a ureter to your kidney. So you have a ureter, kidney, goes to the bladder. So it's very easy for that infected urine and that bacteria to travel upwards to the kidney. Once the kidney has an infection, this can cause more serious symptoms, including fever, vomiting, even diarrhea. If a kidney infection or pyelonephritis is left untreated, it can actually lead to a systemic infection called sepsis, which is a blood-borne infection that can infect other organs. Pyelonephritis and sepsis are extremely serious when you are pregnant and must be treated as in a medical emergency. You are usually hospitalized and given IV antibiotics. As far as the urinary tract infection, well, this is a more minor infection, but it should be taken seriously. Now, this question does say low levels of bacteria. Would you consider an infection or would you retest? So this is a good point. So when you go to get tested for a urinary tract infection, they ask you to pee into a little cup and they test that urine. Well, if you don't clean yourself properly before you pee into the cup, if you don't collect that sample right, you could actually get a false positive urinary tract infection. So when you get the cup, you usually get it with 2 cleaning wipes. And what you're supposed to do is you're supposed to open up the first wipe and you're supposed to wipe your vagina from front to back. Then you're supposed to throw that away. You open the second wipe. You do the same thing. You wipe from front to back. These are kind of like an antimicrobial wipe to help reduce any bacteria that's sitting there on the surface. Next, you are supposed to pee a tiny bit into the toilet bowl. That's because there could be a little bit of bacteria on the very outside of your urethra that's there from your natural vaginal bacteria. So you pee a little bit to kind of get that out and into the toilet. And then you go ahead and pee into the urine cup for the sample that's used for a urinary tract infection test. If I had a patient with no symptoms and a little bit of bacteria in the urine, I would ask to retest. And I would make sure that they knew exactly how to clean themselves and how to collect the urine. Because if that's not done properly, the whole test can be invalid. However, if I have a patient who has any bacteria and they are symptomatic, I would treat them accordingly as if they had a urinary tract infection. So, urinary tract infections are treated with a wide variety of antibiotics. It depends on the type of bacteria that's been isolated, how many urinary tract infections have you had, how far along you are in your pregnancy. So I'm not going to mention specific antibiotics. In addition to antibiotics, I would also make sure that you're drinking plenty of fluid and that you're drinking pure cranberry juice. So, cranberry juice has been shown in some studies to help treat or reduce bacterial load related to urinary tract infections. Now, this research is not universal, but what we have decided is that the cranberry itself does acidify your urine, and at a higher acid rate, the bacteria can't live as well. So, this is why we like to recommend cranberry juice for women with urinary tract infections. Ultimately, if your doctor decides to treat you for a urinary tract infection, you want to make sure you follow the treatment plan. And that's a very good question. And going along with that, let's start tonight with some of our questions about urinary tract infections that we have already, because they go along with this one, which is a great test or a great question. So I have another one that says, hello, I've had a UTI for a month. Or from a month. My doctor prescribed 2 tablets a day and cranberry extract juice for the infection. I took it for a week and after that was infected again. I don't know if the discharge is coming from my uterus or my urinary tract. I'm 28 weeks pregnant and I'm very worried. Last time I lost my baby at 28 weeks because of the doctor gave me progesterone tablet to insert into the uterus for 10 days. After using that tablet, I think the infection started. Please tell me what I have to do to deliver my baby safe and healthy. So the first thing I'm going to tell you in this question is, of course, I'm really sorry that this has happened to you before. If you're getting repeated urinary tract infections, you want to make sure 2 things. The first thing is make sure when you're providing that urine sample that your doctor is sending that test out for what's called culture and sensitivity. So what they do is once they figure out there's bacteria in your urine, they take a little tiny bit and they put it onto a petri dish and they grow that bacteria. Then they use all different types of antibiotics and they swipe it across the bacteria to see which one kills the bacteria best. This tells them which is the best antibiotic to use for your infection. Not all antibiotics work the same, and not all antibiotics will kill every single urinary tract infection. So if they're using the wrong antibiotic to begin with, it may actually make the infection come back, and it could make the infection harder to treat. Now, the other thing is, what you want to make sure is that you're taking all of the medication exactly as prescribed. When we have an infection and we treat it with an antibiotic, after a day or 2, we start to feel better. And so as women who are pregnant, we oftentimes feel this urge to make sure that we protect our babies. And we think that all medications, if they're not necessary, shouldn't be taken. But the thing is, after you've started an antibiotic for an infection, it's important you finish the entire course of treatment, or the infection can come back, and it usually comes back within a week. So make sure if you do start an antibiotic, you're taking the entire course of treatment. Now, the other thing I'm going to say about this question is you talk about insertion of a progesterone tablet into the uterus for your last pregnancy, and you think that may have contributed to the infection. So when we insert medications vaginally, there is a higher risk of infection. It's very important prior to inserting anything that you wash your hands well, because our hands touch a lot of surfaces that have a lot of bacteria on them. Then I would also make sure you've had a fresh shower before using the medication. That way you've also naturally washed the vagina to make it as clean as possible from normal vaginal bacteria. This can help to prevent. One of the other things you want to make sure discharge that you have should be cultured by your physician or your midwife. So what does that mean? With a culture, what you do is you take a sterile cotton swab and we just take a little tiny sample of that discharge and we send it to a lab to test it. The discharge can mean all different things. And so you want to make sure that you're checking it to make sure it's not some other kind of infection, like a yeast infection or a sexually transmitted disease or the like. So that was a very good question. So you're welcome, Letty. I'm glad that helped. And so you had a question about macrobid in the first trimester, especially the recent studies about birth defects. And it's actually interesting. We do have, I saw your question actually on the UTI. So macrobid. Macrobid is an antibiotic. It's also called nitrofurantoin that is used very commonly to treat urinary tract infections without pregnancy. It's extremely effective for this. Now, there is some research coming out about whether this is causing birth defects or not. And really, some of the studies are not very well done, and so we don't really know. But the bottom line is most of these medications, it's risk versus benefits. An untreated urinary tract infection during the first trimester can lead to miscarriage. So if you are not able, if you have like a repeated urinary tract infection cycle, and macrobid is the medication that would be the most effective, the studies have shown that it would be better to go ahead and use that medication. Now, obviously, we want to try to utilize whatever medications that we can that would avoid this, which is why your healthcare provider should be sending out the sample for a culture and sensitivity. Because you may find that a bacteria can be killed by either macrobid or amoxicillin. Amoxicillin is safe for use during pregnancy at the same rate. And then you would want them to be using the amoxicillin. The other thing is that while I just said you want to complete your entire course of treatment, if your healthcare provider starts you on macrobid and then they figure out they can use amoxicillin instead, they can switch you over in the middle of the course of treatment. As long as you complete the second antibiotic, you're still doing what needs to be done. Again, I think part of this has to do with, was there a good sample collected to confirm that there was a urinary tract infection, and how far along you are into the pregnancy to determine risk versus benefit. But a true urinary tract infection should not be left untreated, okay? It puts you at high risk. And the other thing I'm actually going to say about birth defects, and this goes for all medications. So when we see risk of birth defect, a lot of times it's very scary, right? And of course it's scary. But what most people don't understand is you can be walking down the street as an average woman. You have absolutely no medical complications, no medical history. You take no, medications whatsoever. You're on a prenatal vitamin. Everything in your health profile is perfect. You're the perfect weight. You have the perfect amount of sleep, everything. Okay, we got the gist. Perfect, which doesn't even exist. This woman still has a 2 to 5% chance of having a child with a birth defect. Birth defects can just occur. And this is what we don't take into account a lot of times when we see these studies on medications. This is very relevant when you're talking about medications for depression and anxiety. These medications oftentimes will show different risks that women are very concerned about. But when you look at the percentages, oftentimes the percentage of risk factor for, say, withdrawal symptom is less than the percent chance that a woman with untreated depression would develop her baby would develop a birth defect. So when you see that a medication has a chance for a birth defect, it's still just a chance, which is why we also go ahead and look at risk versus benefits profile. Okay. So that was a great question. Thank you so much, Letty. And for any of you that are joining us, please feel free to put any questions you have into the chat. So kind of playing off of this, I'm going to answer a couple questions that we have about antibiotics. So the first question is, I'm 13 weeks pregnant and I have an ear infection on both ears. My doctor prescribed me Augmentin 625 milligrams for 3 to 4 days. Is it safe for my baby? So Augmentin is safe for use during pregnancy, so that is okay. One of the things that I would like to say about this is that when you're asking about antibiotics, you want to make sure that you're talking to your doctor about risks versus benefits and make sure that they're treating a bacterial infection. Ear infections sometimes are bacterial and they're sometimes viral. We're also finding out that a lot of ear infections may resolve on their own with very simple homeopathic treatments, such as nasal spray, like just a simple saline nasal spray and some good, just chicken soup and treat the cold type of deal. So a lot of kids nowadays are not receiving antibiotics anymore for their ear infections because there's so much overuse of antibiotics. So in the case of this mom, while Augmentin is safe for use, if you've only had the symptoms of your ear infection for a day or two, depending on what's going on, you may want to see if you're able to hold out for another day or two if the doctor says the infection isn't severe. Of course, if the infection is severe, if you've developed severe fever and stuff like that, then you want to make sure you treat. The next question, I'm 9 weeks pregnant and was prescribed penicillin VK for a tooth infection. I'm really nervous about using it because there's no study on humans. Generally, doesn't make me feel safe. Can I wait it out? Okay, I actually appreciate that generally term doesn't make you feel okay. For all you mamas out there that are trying to make a decision on antibiotics, it is really tough. I understand that. We don't want to expose our babies to anything that would harm them. At the same time, these infections, if left untreated, can lead to serious consequences, including preterm birth, miscarriage, stillbirth, low birth weight, and more. Okay. In addition, also, if you get an infection yourself, if this goes systemic, it can cause serious complications for you, which is why this question is also perfect. So in the chat, I'm going to link the video that we did on dental care during pregnancy. So this mom mentions a tooth infection, and a lot of us think of teeth infection as very minor. Now, if you don't know this, and most people don't, the teeth are actually almost directly connected to your heart. So for years and years, decades, most people with any type of heart condition were told that they must take an antibiotic prior to any dental work. Okay. Now, more and more research has shown that you don't always have to take antibiotics with these heart conditions before dental work. And they've been changing these guidelines due to antibiotic resistance. However, there are still certain heart conditions that require antibiotic use before dental work because this relationship between the teeth and the heart is so strong. This is also why it's so important that as a pregnant mom, you receive dental care. We often think of dental care as more of a want and not a need, as like a kind of do as needed. But in fact, good dental hygiene is essential for a healthy pregnancy. And poor dental hygiene can actually be a risk factor for a miscarriage. So in the case of this mom, if she has a tooth infection that needs to be treated, she should be taking the antibiotic. Now, this mom was suggested penicillin VK. It's basically penicillin with potassium. What I would be asking the dentist is to coordinate with your OBGYN to determine if you could potentially use straight penicillin, maybe amoxicillin. So your dentists are fantastic, but they do use a very small set of antibiotics. This is their bread and butter. This is what they're used to. They're not going to really go outside the box because this is what they're kind of always relying on. But your dentist may be able to work in conjunction with your OBGYN to make sure there isn't something better that could be used for you. However, penicillin's been used for decades with women who are pregnant, and it's been shown to be very safe and effective. Again, risks versus benefits. But I would tell you that if they're recommending treatment, that you go ahead and get treated. So that was a really great question. And for anybody who's joining us, please feel free to put any questions that you have live into the chat. One of the things we do here in the live Q&A is we answer your questions that you put there. All right, so now we're going to go to a question on bleeding. I'm 8 weeks pregnant now. Since the 4th week of my pregnancy, I've been experiencing very light spotting that continues till now. There are no other uncomfortable symptoms like cramping. I've had a USG, which is an ultrasound done, and the baby already has a heartbeat. Should I be scared for the health of my baby? I would like to know why this spotting is occurring. So, many women will spot or even overtly bleed during their pregnancy and have a healthy baby. So it really depends on the cause, the amount of bleeding, the location of the bleeding. Some of the causes of bleeding during pregnancy and spotting during pregnancy can be vaginal tears. So the hormones that are needed for a healthy pregnancy, they thin out the vagina, the tissue, and it kind of dries it even. So you can start to get these little tiny tears from having sex or even wiping hard after you use the bathroom. And this can cause some continuous spotting. You can also have spotting from different things like a subchorionic hemorrhage, which is a little bleed underneath the placenta. And we'll link that video on that in the description, as well as if you get like a tear in your placenta or the placenta starts to detach, which is called an abruption. Now, a major abruption is a medical emergency, but a little teeny tiny piece coming up could cause that kind of bleeding. What you want to make sure is that you're letting your healthcare provider know what is going on. So bleeding, it can come in different colors. So you can have bright red, you can have dark red, you can have brown, you can have pink. If you're seeing changes in the color, you want to let your healthcare provider know. If you see changes in the flow, you want to let your healthcare provider know, because ultimately they're going to want to assess the situation. In this case, this mom received an ultrasound. That is absolutely one of the standards of care in determining what might be going on. However, just because you had an ultrasound today and then you notice a change in your bleeding tomorrow, don't assume that you don't need to call, okay? You call. Your OBGYN or your midwife is there 24 hours a day, 7 days a week. If they're not there, somebody else is covering them. This is their job. And don't feel silly if you need to ask questions. That's what they are there for, okay? So that's a very good question about bleeding. So our next question has to do with cesarean sections and actually the healing after a cesarean section. So this mom says, I feel a hard lump on the left side above the stitch line. It's not painful to the touch. Should I be concerned? So the answer to this question is probably not. You always want to err on the side of caution, and you want to go ahead and let your healthcare provider know what is going on, because it is your surgical incision. So when we heal from an incision, any kind of incision, one of the things that can happen is we can develop like a keloid scar. And it, for any of you who haven't seen the video, we're going to link the C-section healing video in the chat. But a keloid scar is kind of like this thick, bumpy skin, okay? And it can be very raised and it's like raised. It almost looks like maybe like a line of tissue on top, like a very thick line. Now, that keloid can actually happen on the inside as well. So when you have a C-section, they cut the outer skin and then they open up the muscle layers and they cut through that and then they cut the uterus. So all those cuts have to be sewn up. So right underneath the skin, they have sewn using a dissolvable stitch the muscle back together. So it's very possible at the one side, that's where they tied off the stitch. So it's usually a little bit thicker, and then a keloid developed there. So I would let them know, but if there's no pain, it's probably not a big deal. It also depends on how long it's been. If your C-section is just 6 or 8 weeks old, it's still very much in the healing phase. If your C-section is 2 years old, that's very different. Additionally, you want to look at the incision line itself. If this is a fresh C-section, you want to make sure there's no redness, there's no bleeding, there's no discharge, and the incision isn't opening. If you see any of those things, then you want to let your healthcare provider know. And finally, if your belly becomes hard to the touch or it becomes painful or you get a fever, you want to call them as well, because maybe that little bump is the starting sign of an infection. That's a great question. All right, so moving on. Now we're going to answer a question about drying up breast milk. Okay, and this is a very hot topic because when you're done breastfeeding, you want to be able to dry up your milk really fast. So this mom asks, can I use sunflower lecithin, even if I'm trying to stop producing milk, just to avoid clogged ducts? So your milk collects in the breast in little tiny like milk ducts, and they're kind of like little tiny balls. When you feel the breast, oftentimes they can feel like little almonds underneath your skin or little peas, but those are little, basically ducts full of milk. When those ducts don't empty, you can develop a plugged duct because the end gets clogged up with milk that kind of coagulates into like almost like a clot of milk. And then when you're pumping or you're breastfeeding, the milk doesn't come out. Okay, so you're stuck and it just gets bigger and bigger. And then this big full duct, it's painful and it can become even infected, which leads to mastitis. So when moms are trying to dry up their milk, they don't want to empty these ducts out because remember, everything is about supply and demand. The more you empty these ducts, right, the more it sends you a signal to your body to fill them. So you empty and then it wants to fill, empty and it wants to fill. So we need to keep this full longer, as if to say, hey, I've got all this milk sitting around and I don't need it anymore. Okay. So as a result, unfortunately, when you're drying up milk, your breasts will stay full and sometimes even uncomfortably full longer than you'd like because you're trying to say, hey, stop making milk. I don't need this anymore. But that can put you at risk for these little clot offs that cause a clogged duct. So one of the treatments that breastfeeding moms have learned to use is sunflower lecithin. This supplement can help thin out the milk a little bit so this little clot of milk that causes the clog doesn't happen. So in this case, this mom is saying, hey, I need to dry up my milk, but I don't want to end up with any of these clogged ducts along the way. Can I use this? And the answer is absolutely yes. The idea about drying out your milk still stands. So you're going to try to reduce the amount that you're demanding. That means longer times between pumpings. That means pumping for shorter periods of time. It also means you're going to use stuff like you're going to use cold compresses and ice on the breast. You're going to use cold cabbage leaves. You're going to wear a bra 24 hours a day. You're not going to stimulate with a lot of heat. Like you don't want to shower and put a lot of warm water on the breasts. But using a little bit of lecithin to make sure that you avoid as many clogged ducts as possible is totally fine. And it actually makes a lot of sense because you don't want to develop mastitis, which really, really stinks. Okay, so yes, you can absolutely use that while you're trying to dry out your milk. So welcome to anybody who's just joining us. I am Dr. Samantha, the maternity mentor. And we are here again on Monday at 9 p.m. Eastern Standard for our live Q&A where we answer your questions that you put into the chat. And additionally, we answer any questions that our viewers have left on the videos. So please feel free to put anything into the chat that you'd like to be answered. Our next question is about hypothyroidism. So I am suffering with hypothyroidism and my level is 3.5 and I'm planning for pregnancy. Is it enough level for pregnancy or should I change the dose? So unfortunately, I can't answer this specific question for a variety of reasons. Depending on what country you're coming from, the level number might be different than the level number I use, and what level. So in generally speaking, you're looking at the T3 level, the T4 level, the total T3, and the TSH. And these are all 4 different things, and they mean 4 different things, and they have 4 different levels. So let's talk about thyroid in general. Hypothyroid means low thyroid. So the thyroid is a gland right here in your neck, and it produces this thyroid hormone that is instrumental in so many different aspects of your body. It controls so many different parts of your body that without proper thyroid control, we can have serious effects. Hypothyroidism can cause constipation, cold intolerance. It can cause weight gain. It can cause fatigue. It can cause your hair to fall out. It can cause your heart rate to slow down. It can cause your stomach to slow down. Hyperthyroidism, which is too high, can cause eye condition that causes your eyes to bulge out and can lead to permanent eye damage. It can cause diarrhea. It can cause heart arrhythmias. It can cause you to feel hot all the time. These are just a few of the things thyroid can do. Now, when your thyroid level is out of whack or out of the normal levels, it can interfere with fertility. And it can also lead to miscarriage if you are pregnant. So once you are trying to get pregnant, and then once you become pregnant, your thyroid levels need to be watched closely. You should be managed by a maternal fetal medicine specialist who also has specialty in endocrinology, which is the doctors who handle hormones, or you should be sent to a reproductive endocrinologist. They should be monitoring your blood sometimes every 2 to 4 weeks to see that your thyroid levels are normal and to offer you medication to correct them if they're not. Now, if your thyroid is not at a normal level, so again, this 3.5 you mentioned, you want to get it into a normal range. However, if it's within normal range, you should be good to go. You do want to make sure and insist that they're checking you regularly, even if your thyroid level is normal the first time after it's checked during your pregnancy. If you need to receive thyroid medication during pregnancy, your baby will need to be tested after you deliver. Babies will sometimes develop some transient thyroid problems when mom has a thyroid issue during pregnancy. This is not to worry. The baby will be referred to the specialists in the center where you deliver, and they can help you manage the thyroid until the baby outgrows it. Okay? But yes, you want to make sure you're getting it checked. And unfortunately, I can't answer specifically on that one. I see some more people joining us. Please remember you can put any questions you have live into the chat. Our next question is about labor. So I don't know what to think. I'm super crampy, but I have IBS. So the question is it IBS cramps or the start of labor? I feel pain at the top of the belly. I can hear gas bubbles moving around, so I think it could be gas, but I feel the tightness. I lost my mucus plug the other day, and I feel pressure with every tightening. It hurts. I don't know what to think, and I don't know how long to wait before I worry. My plan is to keep an eye on it and clean, clean, clean. So this is a very interesting kind of statement / question. So IBS is irritable bowel syndrome. Irritable bowel syndrome is often associated with both constipation and diarrhea. The reason why this is important is because at the end of your pregnancy, when you go into labor, you can actually develop diarrhea, okay, and or very loose stool. So when you're getting ready to deliver, you have the uterus, and the uterus goes down to the vagina. Okay, so the vagina is like it's the opening where your baby's going to come out. Right next to the vagina, if this is the vagina, is the anus. Okay, and that's where we get the poop to come out. Okay, so if that is full, you can actually end up where you can't push the baby out. Your body knows this, so your body wants to make sure that it empties out to the best of its ability. That's why you also might actually vomit before you have the baby, because it's trying to empty the stomach out. Basically give you as much space as you can in the belly to allow the baby to move, okay? Now, in this case, she also talks about tightening at the top of the belly. So at the end of your pregnancy, your uterus sits right underneath your breast. It's right at the top. And tightening from a contraction oftentimes starts at the top and kind of spreads out downward, okay? So when you're getting tightening at the top of your belly, that's oftentimes the sign of a contraction. Now, this mom talks about how she lost her mucus plug the other day. Mucus plug is basically this plug of mucus that goes inside the vagina. So your vagina is never completely closed. When they say the cervix is closed, this is the cervix sitting inside there. It's still open a tiny, tiny little bit. It has to, because this eventually has to open. So right here at the end, there's a bit of mucus that kind of builds there to protect it from bacteria coming up into the uterus. So that mucus plug, when you start to dilate, open, it basically falls out. It was a plug. Once it's opened, it has nothing to hold on to it. It comes out. When that happens, that is a sign that you're dilating and a sign that labor may be coming soon. Now, the other thing this mom mentions in her question is she says, I'm going to wait and monitor, and I'm going to clean, clean, clean. Seems like a minor detail when she says that, but that's actually very telling. So there is something called the nesting instinct. And the nesting instinct is something that happens to most women right before they deliver. And this can actually happen before you have a preterm birth as well. Something in your body, probably a hormonal process, tells you instinctually the baby is about to come. When our babies are about to come, there's certain things that we need to have in order to be ready for that baby. And one of the most common things is that we want the house and the environment clean, because babies are considered immunocompromised when they come out. We treat them almost like they're cancer patients. That's why it's so important for everybody to wash. That's why you shouldn't have anybody around them that's sick. That's why nurses are not supposed to be wearing jewelry or to have long nails when they're taking care of the baby, because those two things can carry bacteria. So clean, clean, clean is like your body's way of saying, hey, you need to make sure the environment is ready for this new baby to be protected. So when you are feeling that overwhelming instinct to get things in order, that could be the nesting instinct. And usually labor will begin within 1 to 3 weeks within that time, which seems like a long time, but it's really not. And a lot of women will have that within 48 hours of going into active labor. Now, the other thing I want to say is this mom, she describes like a lot of symptoms of labor, and she says she's just going to wait and see. You don't want to just wait and see. You want to let your doctor know what's going on, okay? There's a variety of reasons why it's important for your healthcare provider to know. For example, if you are 41 weeks, they want you to deliver as soon as possible. So they want to know if you're in active labor. But let's go the other way. What if you're 37 weeks? So a lot of us think 37 weeks is a full-term baby. It is not a full-term baby. 37-weekers are premature babies. 38-weekers are premature babies. This is why we no longer will induce a mom until she's 39 weeks pregnant. There is a lot of brain development that happens in the last 3 weeks before you give birth. A 37-week baby has an immature suck and swallow coordination. That means they may not be able to breastfeed or bottle feed. And if they can't feed well, they're going to the NICU. That's the intensive care unit for babies that are not healthy. Secondly, a 37-week baby has trouble regulating their blood sugar and their temperature. This is because there's neurological processes that haven't fully developed at 37 weeks that control those autonomic functions. That means the automatic functions that our body does. So if your baby can't control their temperature and they're cold, then they need to be in an incubator, which requires a higher level of care. Also at 37 weeks, your baby is at a higher risk of developing jaundice because they have less body fat on them. So jaundice is this condition where bilirubin gets broken down but can't get out of the body. Where the bilirubin that's broken down in the body, it can't go anywhere. It sits in the gut and then it gets reabsorbed and it causes this yellowness of the skin and yellowness of the eyes. If left untreated, this can lead to permanent brain damage. And we're going to link our video for bilirubin and jaundice in newborns in the chat. So it's vitally important that your baby eat well in order to be at lower risk for this. And if you have a 37-week baby, they may not eat well. This can affect your milk supply, et cetera, et cetera. So if you are experiencing signs of labor, you can't just assume that's fine. Because if you're 37 weeks pregnant and we figure out you're in labor, if we send you to the hospital, it may be as simple as giving you some IV fluids in order to stop the labor. Because one of the most common causes of preterm labor is dehydration. Additionally, mucus plug. What if that wasn't the mucus plug? What if that was your water breaking? So your amniotic sac, where the baby lives, it's amniotic fluid. And a lot of people imagine your water breaks and it's this big gush. And that's not the case at all. In fact, for a lot of women, it's just a little trickle. And even when we break the water in the hospital, for those women who come in and their water hasn't broken, sometimes we'll break the water. We use a sterile hook and you don't even see anything because the baby's head is so far down, nothing comes out. Well, that water can also contain pieces of tissue. So if your water breaks and you don't even realize it, like maybe you're in the shower or something, but you see little bits of tissue, you might assume it's the mucus plug and it's not. Once your water has broken, you're at higher risk for developing an infection. And that infection, if left untreated, can cause serious issues for your baby. So this is why when you see signs of labor, you want to contact your healthcare provider. All right. The next question is about pelvic pain. So I had pelvic pain in my last pregnancy and was so happy when the baby finally came because I expected the pain to stop. During the birth of my son, I felt something strange happen in the hip area, very painful. After pregnancy, it didn't go away. I had damage. 6 years later now, I'm still recovering. Can't seem to find help to recover properly. I wanted to have another child, but I'm very afraid of the pain and if I can carry. Will I be able to have another child even with this condition? So I am very sorry to hear this happens. And unfortunately, pelvic pain oftentimes goes undiagnosed and untreated. So one of the things that can happen is you have the pelvic girdle that's kind of like this almost like butterfly shaped cage where these are your hip bones going down to your legs and your uterus sits in the middle of this. And as the belly gets bigger, there's this little area that it's kind of like hooked together, but it's not bone. It's like a soft tissue. And that's the pubic symphysis, and that can separate. It can open. And that can be extremely painful. And what can happen is when you give birth, that can open up and it doesn't go back together. So for women that experience this, they'll often have a lot of trouble walking after birth. They may even need to use a walker and extreme pain. So this is one cause, and sometimes it requires surgical intervention, but a lot of times it requires a brace around your hips and physical therapy. Now, sometimes pelvic pain is more from the vaginal area, okay? So when you push a baby out, everything has to open up. It has to relax to open up to allow a baby to come through. This can cause damage. And the treatment for pelvic pain after birth is pelvic floor therapy. So this is a specialist who treats pelvic pain, and usually they are women because this can sometimes require manual manipulation. This means they may need to help you by inserting their fingers into the vagina. They will also teach you how to do certain exercises that can strengthen all those muscles. They'll perform specialized treatment, including ultrasound, physical therapy, and they will make continued pain. You want to see a pelvic floor specialist for further examination. You can get treatment and you can get better with the proper diagnosis. For those of you who are joining us, thank you so much. This is our live Q&A session. Please feel free to put any questions that you have into the chat. Don't hesitate. Don't be shy. This is what we're here for, to answer your questions live. I think I am about to answer our last question that came in off of one of our videos. So let's go to it. It's preterm birth. I'm 17 weeks and 3 days, and I had a cerclage at 12 weeks. I have a history of late cerclage for my first child at 20 weeks, and she came out at 29 weeks. So I had a cerclage put in at 12 weeks this pregnancy. I am also using Cyclogest progesterone once daily, but no bed rest. I get scared of having a miscarriage or preterm birth. Do I need bed rest or will I be fine? Okay, so let's start with some terminology, a cerclage. So we got our uterus, and at the bottom of our uterus is the opening. This is the cervix right here. And the cervix is supposed to be long, thick, and closed. Okay? This is what we want a cervix to look like. When you have preterm birth, that means the cervix starts to open up. The other thing the cervix does is it goes from this thick to thin as you dilate. Okay? That's what it looks like. This is the bottom, and it goes like that. Okay? So we don't want that to happen. So when we notice that a woman has an incompetent cervix and she's starting to potentially dilate, we look, and if she still has enough length of her cervix, we can do what's called a cerclage. And a cerclage is a stitch. It stitches this closed. It's just like stitching a hole in your fabric, okay? We use this, obviously a sterile surgical needle and sterile surgical thread. And we go in and we just basically sew this, okay? Now, there are risks. You can potentially rupture or put a hole into the amniotic fluid, and that would be a potential for a miscarriage. But usually if the cervix is long enough, we should be fine. And then when the mom goes into active labor and we know she's going to deliver, we go ahead and we just cut that stitch. It comes right out, and then the cervix will open up for delivery. So with a history of a previous need for a cerclage, oftentimes, if there's any signs at all, the doctor will go ahead and offer you a proactive cerclage to just avoid any issues from the beginning. So this is what this mom chose to do. She chose to get an early cerclage, which is great. So let's talk about bed rest. So if you're not having active signs of preterm labor, just because you had a cerclage does not mean that you need bed rest. In fact, you might not have ever needed a cerclage. So one of the things that is hard to understand is that when you've had a previous history of an incompetent cervix, it does not mean your cervix is always incompetent. The risk is higher, and it is more common for you to have it again if you've had it already, but it's not a guarantee. So you might have gone through this pregnancy without ever having any issues at all. Now, doesn't mean that getting the cerclage was a bad idea. I'm not saying that. But it means that you don't need bed rest if nothing is going on. Now, why do we avoid bed rest? Bed rest sounds like something we should do if there's a risk. And it was used for years and years and years and years and years, like all the time. Now we know that bed rest is not always the right thing to do. So our bodies are meant to walk around. When we walk around, our muscles help move our blood and circulate our blood. Our blood holds our oxygen, it holds our nutrients, but it also holds our waste, okay? It helps to put things where it's supposed to go. So waste needs to go through the liver and the kidneys to get out of your body. Oxygen needs to go to all your tissues. Carbon dioxide needs to go to your lungs so it can be switched out for oxygen. If our blood is not circulating and moving, our organs aren't getting fed. So it is essential that we keep that going. And we move our blood by moving, by walking. Okay? When you're on bed rest, you stop moving. And that is not good from a health overall body perspective. Okay. Now, women who are pregnant are at higher risk for blood clots. We have higher levels of certain hormones and substances that will increase the ability for us to clot. Clotting is when you cut your finger and it stops bleeding right away. That's because it clotted. The blood stopped off, okay? You need this because if you go into labor and you deliver, when the uterus comes off of when the placenta, which is the organ that feeds your baby, comes off of the uterine wall, there's a whole bunch of open blood vessels that need to clot off immediately. And this is why women have that ability. It's to save our lives and prevent postpartum hemorrhage. And we'll actually link our postpartum hemorrhage video in the chat for you, okay? So because you have those increased clotting factors, that's what they're called, if you stay just laying in bed all the time, you are at risk for developing a blood clot in your calf. If that blood clot, which is, sitting in the vessel, if it detaches, it can travel through your body and cause significant severe complications, including a stroke. So we don't want that to happen. The more you move, the less likely this is to happen. That's why they also tell you when you're taking a long car trip, you have to get up every couple hours. That's why they also tell you if you're taking a plane trip, you need to get up and walk the aisles. This reduces your risk of clots. Now, if you're on bed rest, you're also at risk for pneumonia. So why does that happen? So our lungs are up here, right? And our lungs need us to take deep breaths. The more we take deep breaths, the more we move the air and the bacteria that is in the air out of our lungs and into the rest of our system or out into the environment. If you are not expanding your lungs regularly, secretions can sit in there. And those secretions, if left just there, can start to grow bacteria and lead to pneumonia. Pneumonia is one of the infections that's easiest to become sepsis. Again, sepsis is that systemic infection that can cause organ failure. And so we don't want that to happen, which is why we need you to move around. Now, bed rest. Let's talk about it from a mental health perspective. When you're stuck on bed rest, this means you're stuck at home all the time, 24 hours a day. You're not really going anywhere. Maybe you go from the bed to the couch, but that's pretty much it. When there's weddings and shopping and activities, you can't go. You have to stay at home. You no longer can go to the office. You can't socialize with the people that you're used to socializing with. It can become very, very isolating. It can also become very demeaning. You start to feel useless because you can't do the things. You can't cook. You can't clean the house. I try to encourage women to do as much as they can when they're on bed rest, like, pay the bills, make the appointments, but there's only so much you can do when you're sitting there. So we want you to be out with society, with doing things as much as you can, because these are the things that really encourage a healthy pregnancy. So you've had a preterm birth though, and you're worried. So what is good ways for you to be careful? Ask for help. Don't do any heavy lifting. This is where we make a big mistake. Okay, so here's what I say. You can do the laundry, but you can't carry the laundry basket. You can go shopping for groceries, but you shouldn't be carrying the groceries inside. You potentially can go to an amusement park, but you should be using a wheelchair. Okay? You want to make sure that if your body is telling you it's tired, take a nap. Listen to your body. Don't overdo it. Ask people for help, okay? If you are not feeling well, you want to listen to that. But you should still be able to do most of the things that you were meant to do unless your healthcare provider told you otherwise. Now, the other thing that kind of goes along with bed rest and preterm labor, let's talk about sex. So, a lot of women are like, can I have sex? Like, what am I allowed to do? You need to ask your healthcare provider. Do not assume that you cannot have sex unless you've been told. Additionally, do not assume that sex means everything. Some women are not allowed to have any penetrative sex. So that means no toys, no fingers, no penises. However, they are allowed to have external stimulation and orgasms. So you want to find out what's allowed when you are on some kind of rest, or if you are at risk for preterm birth. The other thing is that some women are allowed to have anal sex, but not vaginal sex. So it's important that you ask these questions, because a lot of women are embarrassed. They don't want to ask, but sex is a very healthy part of your pregnancy, of your relationship, and you want to make sure you're doing things right. In the same regards, you do not want to be doing something that could put you at risk. And maybe your healthcare provider, just assumes you know what you shouldn't be doing. So just ask. That's what they're there for. They're used to all of these questions, and it's good. So we're kind of at the end of our live Q&A session. We've answered all of the questions that were put on our videos. For those of you who are joining us, if you have any last minute questions, please put them into the chat. I just want to remind you, we're trying to put out videos every week. So please take a look. We've got some exciting videos coming up for you. Remember to check out the channel, share it with your friends and family. We do have additional content on Twitter, Facebook, and Instagram. Make sure you like and subscribe to the channel and hit the notification button so you can get notified when our latest content comes out. We are here every Monday at 9 p.m. Eastern Standard Time to answer not only your questions live that you put into the chat, but also questions that you've placed on the videos. We're trying to make sure that we answer all of those for everyone. And we will be posting these live Q&A sessions onto the channel as well, so you can refer back to them. I don't see any questions coming into the chat right now. So I want to thank you guys so much for joining us. I'm Dr. Samantha, the maternity mentor, and I really appreciate everything. And I hope you have a wonderful, wonderful evening. Bye for now.